It's that time of year again. New Yorkers are now entering the midst of flu season as we approach winter. Specialist on infectious diseases for Essen HealthCare Dr. Mana Rao explains why the flu spreads easily during colder months.
There used to be this misconception that the winter causes the flu, but that's unfortunately not true. People spend a lot more time indoors with the doors and windows closed, and there's a lot of recirculated air which they breathe. And so if someone's harboring the virus or if someone's sick, there is a greater potential for transmission.
A similar pattern is shown with COVID-19. As the CDC reports, it's likely that flu viruses and the viruses that cause COVID-19 will both spread this fall and winter. While the city waits for the COVID-19 vaccine set to release this month, health providers and city officials are urging New Yorkers to sign up for the flu vaccine. Dr. Rao explains why the flu vaccine is critical, especially this time of year.
For the reason we want people, and we push rather for them to get the influenza vaccination is because, as I said previously, the two can occur together. And we don't know if the co-infection of SARS-CoV-2 and influenza can be potentially more severe than either of them alone.
At the start of the pandemic, there were many misconceptions about COVID-19 and the flu. During this year's flu season, it may be hard to tell the difference between the two viruses, as both are contagious respiratory illnesses with clinical features that can overlap. Dr. Rao points out these key features to note when differentiating the two viruses.
Influenza, while it can be severe, can also cause mild to moderate disease in a number of individuals. COVID can tend to be more severe, as we know, in those who are above, 65 years of age, those with certain medical conditions, and those individuals who have a compromised immune system.
Both viruses also share many of the same symptoms. Some include fever, chills, cough, and shortness of breath. However, there is a major differentiating symptom to look out for.
SARS-CoV-2 virus, which causes COVID, can lead to a loss of taste as well as smell sensation, which we haven't seen with influenza thus far.
At the moment, Dr. Rao believes there isn't enough evidence to fully determine how flu season will react in the wake of COVID. In the meantime, many health professionals encourage everyone to practice these preventative measures to keep their family safe this season.
Wearing a mask, which is universal source control, frequent hand washing, either with soap and water or alcohol-based hand rubs, social distancing, and avoiding large gatherings, getting your flu shot.
To learn more about the flu and COVID-19, visit the CDC link below. Reporting for BronxNet, Kibin.